Opioids are a class of drugs naturally found in the opium poppy plant. They include prescription painkillers and illegal drugs. The opioid epidemic and the disease of the substance use disorder predated the COVID-19 pandemic, but the isolation and disruption caused by the pandemic exacerbated the crisis, especially among youth. In 2023, Maryland reported 2,513 overdose deaths. 2,513 overdose deaths, with 87% linked to fentanyl, a powerful synthetic opioid. Montgomery County accounted for 138 of those fatalities, according to the Maryland Department of Health. Our county participates in Maryland's Overdose Response Program, which offers free training to identify common opioids, instructions on how to recognize an overdose, and how to administer Narcan, a medicine that rapidly reverses an opioid overdose. Our public schools work with the Montgomery County Goes Purple Community Coalition to offer support around substance use by increasing access to Narcan, connecting schools with youth support programs, and offering resources to families. This month is the launch of National Recovery Month, led by Montgomery Goes Purple. This initiative highlights the importance of recovery and encourages individuals with mental health or substance use disorders to seek help. Montgomery County held a remembrance ceremony and candlelight vigil on Thursday, August 29th in downtown Rockville. It's done it several years to memorialize lives lost to the substance abuse. And if you're experiencing a mental health crisis, call or text 988, which is the Suicide and Crisis Lifeline. I'm going to turn it over to my colleague and friend, Councilmember Albornoz, who's the chair of the Health and Human Services Committee. And then we're going to ask LaTanya Rich, who's the executive director of Tree of Hope Association, to say a few words. And then Gabe and I'll read the proclamation.
Thank you so much, Councilmember Katz. So Councilmember Katz and I are here in our capacities as chair of the Public Safety and Health and Human Services Committee because those are probably the two county agencies who are the closest to this issue. But we have to acknowledge that this issue touches every single committee that we have before the council. And I really want to express my appreciation to all of my colleagues who have made this issue a significant priority. And I in particular want to thank my district colleagues who are tackling this issue head on, whether it's hosting town halls or connecting providers to and constituents to ensure that we're creating a social safety net. We're all doing our part. Every year, I have participated and gone to the Montgomery Goes Purple event that Laura Mitchell and her incredible team produce every year. And I go for a number of reasons. One, because I want to do my part to support the incredible organizations and the frontline social workers and case managers that are doing everything that they can to support the families that are in crisis. I go to also support the families themselves. But I also go to remind me and all of us that this impacts everybody in our community, regardless of where you live, regardless of your age, regardless of your zip code. This is impacting everyone. And we have to have a holistic approach to address these issues head on. That involves ensuring that we support the organizations that are on the ground. That involves ensuring that we eliminate the stigma. But it also involves ensuring that we do a better job of connecting our organizations to the work of our county government and vice versa. I'm proud that our Department of Health and Human Services, in collaboration with the state, is doing more to address issues of treatment, doing more to address those issues of stigma. And I was also particularly proud that our superintendent, who spoke at the most recent event, began and led with that they are working aggressively within MCPS to ensure all staff are trained in how to administer Narcan. These are important steps, but we have to continue to focus on working collaboratively to address what we know is a tragic and very significant issue. So thank you, Councilmember Katz. Thank you to all my colleagues. And thank you, most importantly, to the folks behind me and your staff for all that you do every day. Thank you.
Thank you. We're going to ask Ms. Rich to please say a few words. Please.
All right. Thank you. Thank you. I want to thank the council for inviting me to do this. It's such an honor. Thank you again. It's such an honor to be able to do this. And, my husband and I started this organization along with a few other friends because we wanted to fill in a gap and we wanted to kind of build a recovery community. But the response that we've gotten from this county has been overwhelming. We've been able to serve the shelter systems. We have our youth peers here who serve in Montgomery County Public Schools. We're in treatment. We're in the hospitals. We're everywhere, and the asks keep coming. And I'm just really proud to be a part of this system. The people behind me have all worked with us to make sure that no one's left behind. I had a meeting the other day with the hospital, and they were saying that people come in, the same people come in week after week, and we want to make the referrals, but we're getting a little discouraged. Can you give us some success stories? So I had my steer team write a bunch of success stories. We got them on big posters, and we're going to start posting them up at the ERs, right, to encourage those nurses to actually pick up the phone, right? We just went to a convention, a world convention of a 12-step group that we participate in. I am a person in long-term recovery for 23 years. And there were over 20,000 people from all over the world that converged on Washington, D.C. And the theme of that convention was the power of love, right? And I know it's a perfect thing for this county. We're really fortunate to be a part of Montgomery County because everyone cares, everyone gets it, from the government level all the way down to the grassroots. We're all connected, working in cooperation, especially since the pandemic. It kind of changed the whole game. We came to understand that we actually need each other. And Megan Westwood has been my mentor since day one, but working in cooperation and just watching that light come on for an individual. So it doesn't matter if one person doesn't get clean. The one that matters is the one that does. I was trying to write a real speech, but I always go off the rails. But I looked at Biden's proclamation speech for 2023, and he says, this recovery community is essential to people's well-being, to the ability to lead whole and productive lives, to find joy and meaning in taking care of themselves and their loved ones, and to give back to their communities and our nation. It's all about dignity, right? And so we, as a community, we return that dignity by working together in cooperation because no single program is the answer. Right, we collectively are, and I'm so glad that Montgomery County embraces that philosophy, and I'm so proud to be a part of it. Thank you.
And we're proud that you're a part of it. Okay, why don't you start off, and then
All right, so we will now read the proclamation. Whereas September is commonly known as National Recovery Month and Suicide Prevention Month, it is also a time to bring awareness to opioid use in our country and in our county. And
whereas, according to the latest provisional data from the Centers for Disease Control and Prevention, an estimated 107,543 lives were lost to overdose in the U.S. during 2023, a decrease of 3% from the 111,029 deaths estimated in 2022. This is the first annual decrease in drug overdose deaths since 2018, and
whereas from July 2023 to June 2024, Maryland had 2,030 overdose deaths, of which 1,763 were opioids related. Montgomery County had 93 overdose deaths, 71 related to opioids.
take the next one too.
And whereas an overdose can be attributed to many factors, it can happen when an individual uses a substance that has been contaminated with a highly potent opioids or other drugs, or when the person misunderstands the dosage of the medication they are taking. And
whereas every community across our country has been impacted by the opioid crisis, behind all of the statistics are families, friends, and communities that will never be the same. Now, therefore, be it resolved that the Montgomery County Council recognizes the month of September 2024 as Opioid Awareness Month. And furthermore, be it resolved that we remember those who have been lost. We recommit to working with our community partners and our Department of Health and Human Services to do everything possible to prevent substance use and overdose. It's presented today, and it's signed by Councilmember Albornoz, myself, and the Council President, Andrew Friedson. Thank you very, very much for all that you do. We have a couple other copies.